People need to innovate and keep up with technology, or they're not offering their patients the best eye care available.
Now we have combined data, so your decision is much more precise than before.
We are all practicing, and glaucoma in particular represents an amazing opportunity because we have a long way to go.
My name is Douglas Leva. I'm 69 years old, and I practice general ophthalmology. My father was an ophthalmologist. He started the practice in Ridgewood in 1957. I joined his practice in 1986. We do comprehensive ophthalmology, a lot of glaucoma, cataract, and refractive surgery. So I take care of anything that walks in the door. We expect to give our patients the best ophthalmic medical care available. We have patients that have been in my practice for decades and 3 generations, and we're pretty well known in the area, and we try to live up to our excellent reputation. By investing every year, I've been able to maintain a very up-to-date practice and always have the latest technology available for my patients. Technologies that we have available to us allow us to diagnose and treat various ocular conditions much more appropriately because we have data that we can refer to that we didn't have in the past. People need to innovate and keep up with technology, or they're not offering their patients the best eye care available.
My name is Dr. Laszlo Kirai. I'm 47 years old and I'm refractive surgeon here at Smile Eyes. Smile Eyes here in Leipzig was founded in 2012. Smile Eyes started as a full service provider for the whole eye for the patients. We have a lot of young patients in refractive surgery. We have a lot of older people in the general practice. We have mid-aged people with glaucoma. We have a department for children. So we do everything you can do in an ambulance setting. For us, it's very important to offer always the highest standard in ophthalmology. This means in education by our staff and doctors, and also in the technical equipment and the digitalization for the workflow for our patients. There was a lot of improvement, especially in glaucoma. Now we have more information about the eye, a lot more treatment options, so we can prevent blindness in glaucoma patients, and we can treat the patients in a very early state because we can diagnose them much earlier than before.
My name is Matt Schlenker. I am 42 years old. I'm an ophthalmologist, a glaucoma and advanced anterior segment cataract surgeon, and I work at Toronto Western Hospital. Toronto Western Hospital is one of the largest and oldest ophthalmology programs in Canada. It serves a broad base of tertiary care complex patients where they come in all over from Ontario and sometimes beyond to get their complex eye care needs met, sometimes involving multiple subspecialties. I commonly work with the retina team, the cornea team, sometimes the low vision team, and our general ophthalmologist in providing care for our patients. Innovation comes in where we have the opportunity to help these patients by coming up with new treatment modalities and also earlier diagnostic and better accuracy in detecting progression. Glaucoma is one of the most leading causes of irreversible blindness in the world. It is a devastating disease. People very slowly lose their vision in ways that they do not always notice. We call it a thief in the night, in the sense that people first lose their peripheral vision, and it can sometimes happen in one eye, and the other eye can kind of make up for that in their day-to-day living. They don't really have symptoms from it until people start to get the tunnel vision or sometimes central vision defects. Once it's at that point, it's unfortunately too late, and it's a chronic disease. It's very much a journey. It's a marathon in terms of their treatment.
When patients find out they have glaucoma, there's fear of going blind. What I do is I reassure them that A, glaucoma is treatable, and B, that we're gonna be able to monitor them, so if there's any significant degradation in their vision, we can intervene at the appropriate time.
We have to be careful and very sure that it is glaucoma and then tell the patients we have very good diagnostics. We have a lot of pharmaceuticals, we have a lot of laser treatments, we have a lot of other surgery options. So stay with us and we care, and so you don't have to be afraid.
We can diagnose earlier, figure out who are going to progress, get them on appropriate treatment, then we can either stall or even completely halt this progression.
Our glaucoma workflow is we start with IOP measurements, mostly with the Goldmann applanation tonometer, and then we have the diagnostic tools like the ZEISS OCT, we have the Clarus for the fundus imaging of the optic nerve. And for the visual field, we use the HFA for visual field testings.
Glaucoma has changed over the years. In the past, we didn't have the technologies that could identify early disease. So a lot of times, patients were treated unnecessarily because they had elevated pressure. What the technology allows us to do is identify those patients that just have elevated pressure or are actually going to progress on to disease, which is glaucoma, and develop an optic neuropathy. In order to do that, we need good data. I have the Humphrey visual field that gives me the 24-2C, which they've been able to speed up the testing. And not only does it give more accurate test results because patients don't have to concentrate that long, but it actually gives me additional data points that I can analyze going forward. But what we all know is that you can damage up to 30 to 40% of the optic nerve before we have visual field defects and notice any change in the visual field. So that's where the OCT comes in very important. The ZEISS OCT is able to measure the nerve fiber layer and is also able to measure the cup to disc ratio in a very reproducible manner so that we can establish baseline after we get a couple of tests, and then we can monitor for any longitudinal progression in the condition of the function and the structure of the optic nerve.
My practice is a tertiary care practice. It is referral-based from ophthalmologists and optometrists who've been following patients. By and large, most of my patients are aware that they either possibly have glaucoma or for sure know that they have glaucoma, and they brought in for secondary or even a tertiary level of care. So I will take in OCTs, I will take in visual fields, I want an eye pressure history, I want a medication history, and I want a vision history. Those are the 5 things that I ask from all of my referring physicians. When the patient comes to see me, based on what they've already had, I will order a bunch of tests as well. Every patient will get another OCT, every patient will get a visual field, every patient will have an assessment, a full clinical exam, including careful assessment of their optic nerve and their eye pressure. And we're going to put those all together to come up with a treatment plan for the patient.
Our results are connected to the glaucoma workplace, so you see it on one desk. So you see the visual field results, you see the OCT, you have the IOP measurements, and also the fundus imaging of the optic nerve. We have normalized data, so it's much more objective and it saves a lot of time. Advantage for the patient is that the patient gets the right diagnostics. Maybe the patient is on drops, maybe he needs a laser surgery or an implant, and you have to make this decision. Now we have combined data, so your decision is much more precise than before, if there's progression or not, even in the follow-up after years. And as a doctor, make a decision for new drops, for SLT laser treatment, maybe for implants.
Many of my instruments are ZEISS, and I have them all connected to Form, which is a database that connects all my imaging technologies. Glaucoma Workplace has been a really phenomenal software that has made my job much easier, and it actually has improved the workflow tremendously. Because in the past, to compare different visual fields, I had to physically take them out of chart, put them on the table, compare them. Now with the Glaucoma Workplace, I can see all the visual fields simultaneously, but more importantly, Glaucoma Workplace creates graphs that we can identify if the patient's visual field index is decreasing, if the cup to disc ratio is increasing. We have the OCT data that we can see if the cup is getting larger, the nerve fiber layer is diminishing in overall or in individual quadrants. You know, I'm seeing in general 6 patients an hour, and I don't want to miss things. And so I can walk in the room, Glaucoma Workplace is up on the screen. I can identify immediately, just at a glance, if there's any pathology.
Glaucoma Workplace has revolutionized the way that we can analyze our glaucoma data. What I like about it is it brings the structure and function into one place, and it gives the doctor a dashboard to manipulate these to assess for progression over time. The first thing I do is I do look at the OCT images, the visual field images, and the fundus images on their own. But then in the Glaucoma Workplace, you can put them all together on one screen, so you can assess for structure-function correlation. So you want to assess to make sure that the pattern you're seeing on your OCT fits with what you're seeing in the visual field. And of course, you're going to pause if those two modalities are not fitting. The other big benefit is once you've established some baseline testing, over time, you can actually quantitatively analyze that data over time. And we can do that right on Glaucoma Workplace, right in front of the patient. And it's very satisfying, I think, both for the physician and I'd like to think for the patient as well, to see that downward trajectory all of a sudden halt and become stable.
There are some patients that are on drops maybe for years, 10 or 20 years. They have some problems like allergies or the compliance is bad, whatever. So in this patient is a very good option to do an SLT laser. I feel much happier when I know I can control the IOP with the SLT laser and I don't need drops because it's in my hand, the control of the IOP, not in the patient's hand. And the patients, maybe they are like on 2, 3 or 4 drugs for glaucoma. I think it's always good if it's possible to reduce the drugs you need. ZEISS Visualized Green SLT laser treatment is nearly like an eye examination because it's with a slit lamp, nearly looks the same, a very mild laser treatment, and even for the surgeon it's a smart procedure. I mean, it's like a 5 minutes procedure. You need not a big setup like an OR, you can do it in your practice. Very convenient, very short. The ZEISS Visualized Green SLT laser is a fully integrated and connected device. So you have all the data on the laser, and even after the treatment, you send your laser protocol to Forum, to the Glaucoma Workplace, so you have it on one place. You have this success in a lot of patients, and it's such a mild treatment.
There's a variety of times where there's potential complexity in the glaucoma. Patients' eyes and their optic nerves come in many shapes and sizes, and that can make it challenging to separate a normal variant from a true glaucomatous nerve. It becomes much clearer if we have a lot of data on the patient, especially with our new diagnostic and progression software in Glaucoma Workplace. On the progression side, things can be challenging from noise. Anytime we have noise over time, so patients doing better or worse on any of their imaging or visual function modalities, it makes it harder to separate someone who's truly progressing from someone who's just having up and downs in their testing. Surgery can be complex in the side that our outcomes can be difficult. We are basically trying to clean out an existing drainage system to try to enhance the flow and reduce the eye pressure, or we're trying to make a new drainage system. Both of these are wrought with challenges, so we are trying to become more precise. We're trying to do less collateral damage to the eye to avoid collateral scarring, and we're trying to find new, safer ways to do our surgery that have faster recovery and have less impact on patients' quality of life. I really like the optics of the Artivo system. I think that helps us to have precise surgery. We also have very fast focus, zoom, XY capability on it. I love the recording system. We do this to audit all of our cases to really assess our surgical process and also our outcomes. Also, we have the opportunity to integrate the ZEISS biometry that we're taping in our clinic to measure the patient's eye and put that into the Artivo system as well to get better real-time feedback.
In the future, we expect from ZEISS more data with this device we have. There are a lot of data in OCT scans. You can calculate for detection of glaucoma and prevent of glaucoma. I think in the future we will see much more AI-based algorithm to analyze the data from the OCT. This would be the next step in glaucoma screening and diagnostics.
We are all practicing in ways to try to achieve better outcomes for our patients. And glaucoma in particular represents an amazing opportunity because we have a long way to go. What's revolutionized glaucoma diagnosis and glaucoma therapy has been innovation, and we are on the backs of many clinicians and also companies that have come together and come up with ways to help our patients. And I'm so happy that I'm in this era treating glaucoma versus, say, not long ago where there's really, very little on the diagnostic side, 1 or 2 drops and 1 or 2 surgeries. And now there's been an explosion of innovation, and I just hope that this can continue.
We didn't have that sort of technology in the past, and it's made an environment that allows me to just practice better ophthalmology, especially with regards to glaucoma.